My name is Miranda Simpson. This is Mr. Jones. Today we're going to be doing the heart and neck vessels examination. So first we're going to start with, keep your head straight, the carotid artery. So you're going to palpate on each side. You don't want to compress both sides at the same time as it can cut off circulation. Secondly, we're going to listen to the carotid in 3 places. And I did that on both sides. Have you been having any shortness of breath or dizziness? No. Okay, can you go ahead and lay back? Secondly, we're just going to visualize the carotid pulse, and then we're going to visualize the jugular vein, and you can actually measure CVP or central venous pressure. So you're going to see where you can see it at the top and then where it stops on the chest. And you would actually have a ruler this way and then a ruler this way to measure. So you can see his start about right here, and then it ends about right here on the chest. So that's where you would place your rulers. Next, we're going to just inspect the whole chest, make sure we don't see any abnormal movements, and then we can palpate. You been having any chest pain, Mr. Jones? All right. We can also use percussion to check for enlarged heart, although this isn't very accurate. They use chest x-rays and CT scans normally. Next, I'm going to listen at all 4 points. First, you come down to the 5th intercostal space on the left side. And then you're going to come down to the level of the nipple. So right here would be his apical heart rate. You're going to listen in all 4 locations. Next, we're going to count the heart rate, and you'll count for a full minute. Heart rate is 71, which is within our range of 60 to 100, and his heart rate is regular. Next, we will use the bell side of the stethoscope to check for any murmurs. So will listen again in all 4 locations. If he has a murmur, it'll sound like a swooshing sound. All right, now we'll have you lay over on your left side. And then we will check again for a murmur on the left side. And using the bell side of your stethoscope, you can also check for S3 and S4 sounds. Okay, you can turn back over. If you do hear a murmur, you will also want to note the location, and if it is a grade 1 through grade 6, with grade 1 being the lightest, very difficult to hear, and a grade 6, you can still hear it with the stethoscope lifted off the chest. Next, we are going to do our exam of our pulses and our vessels. So we always want to check both sides at the same time so that we have a baseline to compare. So we can start with both radials. Make sure that they are both strong and that there is no differentiation. And then you can move up. We'll also check for any pain or swelling in his arms. Okay, good. And then we'll move down to his feet and feel for pedal pulses. You can feel on the tops of the feet down from the big toe. And we'll move to the ankles. Feel on the tops of the legs. And pulses are rated from 0 to 2+, 0 being very weak to absent and 2+ being bounding. Now, lift up your knees. We'll feel behind the knee. If a patient has bilateral lower extremity swelling, this can be a sign that the heart is not pumping well, as in congestive heart failure. You can lay your legs back down to feel your femoral pulses. All his pulses are equal. That concludes our assessment.